Welcome back. So we're talking about how to release low back pain using these myofascial release balls. And this is part 2. It's going to be more how you can release things more indirectly, because oftentimes our low back is so inflamed and in so much pain that putting the balls either into the areas that I did on my last video, which was more into the abdominal psoas area, or directly into the low back, often that can be way too much because like I said, we're inflamed, the back doesn't feel good. So if that is the case for you, this is a different way to release things that, like I said, are more indirect. So they're connected up into that area. And again, remember, the fascia connects to everything in our body. So you could do a release up here under your suboccipital space, like right under that skull bone right there in the top of your neck. And that could totally affect your low back. It does all the time with people. It's amazing how many releases I do up in this area for people, and it helps their low back improve. So just remember, this can be anywhere on your body. Listen to your own body. So see what it's telling you. Is there tightness kind of up in the shoulder blade area? And you're like, oh man, every time I kind of push there, I can feel it in my low back. And that might not even be the case. It might just be tight up here and you might not feel that direct connection to your low back, but it could be affecting it. So again, just remember, you can pretty much go anywhere with these release balls and it might help your low back. It just totally depends on what you have going on in your own specific body. But I'm going to show you some areas that could really, really help if you don't really know where to go on your body just yet. So the quads. So the quads are the muscles on the top of our thighs. Again, we're not going for releasing directly into the quad muscle. We're just going for the fascia that is connected, that might be connected up into our hip flexors and then into our low back. Like this whole area, if it's tight, it will for sure connect and do things that might throw your back off kilter a little bit or could give it some pain. So with the quads, again, we're on the stomach. So I'm going to tilt my camera down a little bit. There we go. And so it's going to be, you can do 2 at a time, like we talked about in the last video. So that's a little harder to coordinate with the quad, like the thigh muscles, because it's like 2 separate legs. And so sometimes it's a little bit harder to get on the right spot on both sides. But hey, if you want to try it, go for it. I'm just going to show the single side release. So go ahead and lay on your stomach, and then you're going to get onto your quad. And the best way to find that tight spot is to kind of roll up and down a little bit, like move to the side, back and forth, and go, okay, is there any spot that like really feels tight? Oftentimes, you will feel a little pull into your low back. So being up in this position might not be good for some people's backs. So remember, try to get down kind of into a more relaxed position as soon as you can. So you can roll around a little bit, shimmy down, shimmy up, whatever feels good to you. And then once you're there, hold it for about 3 to 5 minutes if you can, and really concentrate on your body relaxing over the ball and softening, melting. Feel if there's anywhere else, like you might feel tension like up in your glutes, you might feel tension in your low back. See if you can try to let that melt, try to release any of the tension you feel in your body. You might even feel it down in your feet. Try to release the tension in your feet, and you'll be amazed at how sometimes that can translate up into other areas like in your hips, low back, thing like that. So there's a quad release, so that can help with low back pain. Then another good place to release is down lower. So if your back pain is in this area, so it's above your butt essentially, that might be too painful of a place to put the ball, but you might be able to tolerate it down a little bit lower. So down on the sacrum, which is the bone that goes down and connects us into our pelvis. You might be able to put it over on the glutes. A lot of times when people have low back pain, they also get some sciatic symptoms, so the pain radiating down their legs. They might also get piriformis tightness. So the piriformis is a muscle that goes across our glute. Again, I'm going to put video links down in the description below to other videos that give great insight into the anatomy and some exercises that you can specifically do for those areas. But again, I am just teaching ball release. So take one of those balls and find a place where you can settle in with your back, because I know if it hurts, it might take a little bit of time to settle into that. And if you can settle into this area, then you can either just roll onto your side, because it might be too painful to lift your hips up. So you can roll, kind of get that ball under there and then come back on top of it. So right now, mine is over in my glute. So it's in like the big bulk of that butt cheek, essentially. So that's where the piriformis is. It's deep in our glutes. So if you kind of like roll around, move it a little bit, you might find a sweet spot in there that you're like, oh yeah, that's a therapeutic pain. It's the hurt so good, like I can tell it needs this release. That's perfect. If it's shooting pain down your leg and if it feels horrible, don't do it. You're not ready for it yet. So the other thing you can do is you can also, if you can lift up into a bridge, you can get this ball underneath that sacrum. That's like the part that attaches into your tailbone. And so that, it sometimes feels like a little more pressure into your back, but if you can put it, and make sure you put it lower on your sacrum, like towards the tailbone. If it's up too high, it's just gonna make your back arch, and that won't feel very good. So make sure it's down like towards your tailbone, down farther, and then you'll notice that your back kind of can settle down towards the ground in that position. And again, that can really help to take some stress off of the low back if you're at a place where you can tolerate that. So that's a really good thing. Now, if you have that down there, so again, it's under the base of my sacrum down towards my tailbone, and you feel comfortable there, then if you have this other ball and you put it, it's essentially like if you feel the ridge of the bottom of your skull back here, so come down and then feel that ridge, then right underneath that, that's kind of like where your neck starts. If you put that ball kind of right below or like right at that ridge, this, I'm not gonna do it too long so that I'm not turning my head on this ball too much, but if you can do this position and allow yourself to really sink into it, this will actually stretch or open up the entire kind of, it's called the dura, but it's the sheath that surrounds the spinal cord. And so it connects all the way down and all the way up. So if you can tolerate, and if it feels good, to have the balls in this position. So one under the base of your skull up here in the suboccipital space, we call it, and then one under your tailbone down here, you will actually start to feel kind of an opening through your whole spine, and it can feel really, really good. Now, again, if this is causing you increased low back pain, don't do it. You're just not ready for it yet. So this is, again, a more indirect way to get to that, but for every person, their back pain is different. So if it's causing you pain, just don't do this yet. So stick more to the other indirect ones. So like the quad release, the glute release, or if all of those are hurting really bad, I would go up farther in your back. So you can release things all the way up your thoracic spine. So up in this area, like, so your ribs come down to about here. So anywhere from there up, sometimes that can take a lot of pressure off of the thoracic spine. So those are the places that I would suggest for more indirect. You can also go all the way down your hamstrings. You can release your calves. Like all of those places tend to really attach into things that can be pulling on the low back. So try those out. And if you have any questions, you can definitely put them in the comment section below, and I will try to answer them as best I can. But unfortunately, without actually seeing people in person and evaluating them, I can't give you any medical advice. But if you have a question on positioning of the ball or anything like that, definitely let me know. But the best thing to do is to truly see someone for hands-on treatment. So I would highly suggest seeking out a myofascial release practitioner in your area. You can go to myofascialrelease.com, and then at the top there is a button that says Find a Therapist. I would suggest going there to find someone that can help you to truly open up all of the fascial restrictions in your body and take the stress off of your back, especially if this has been a chronic issue for you. The ball releases are amazing, and they're a great thing to do while you're trying to work on this at home. But if this has been going on for a while, I would highly suggest seeing someone, because they will take a look at you from head to toe and be able to see if you have any restrictions anywhere else in your body that could be contributing to your chronic pain. So, like this video, subscribe to my channel if you would like to see more, and I will be providing more videos soon. Have a great day.